Good morning. This is the Blaine's World webcast that can be found each week on Facebook, YouTube, and LinkedIn. You can also find us on Apple Podcasts and Spotify. And you can also get more information, find past shows at my website behind me, which is blainesworld.net. I'm your host, Blaine Greenfield, and I'm here in my Zoom studio in lovely downtown Fairview, North Carolina. And each week we focus on positive news and information about people and organizations in both West North Carolina and throughout the country. And toward that end, it's my pleasure to introduce Dr. Sieara Hinshaw, who's a doctor of physical therapy and owner of Outshine Physical Therapy and Fitness in Asheville. And welcome aboard, Dr. Sieara.
Thanks, Blaine. Thanks for having me.
Okay, and by the way, you can wave to all your fans and friends who are watching this. That is
Hi.
that is Dr. Sieara. And I should mention that Dr. Sieara Hinshaw specializes in helping active adults and athletes feel, move, and perform better with a fitness toward approach to rehab and performance. She's a Hendersonville native and lives in Western North Carolina with her husband Addison and their pup. Was it Maisie?
Maisie.
Okay.
Yeah, Maisie.
Are we going to get to meet Maisie tonight or not necessarily?
She may make a guest appearance with her bark at some point, but
Okay, and that'll be our cat as well.
yeah.
And I should mention, this is not a completely unbiased show in that I'm friends with Dr. Sieara and also been I guess a patient you call it, or a client.
Yeah, a patient, not a
And
client.
my beautiful bride Cynthia works with Dr. Sieara, and she is the absolute best, as you'll see. And before we go any further, I should mention, Dr. Sieara, that, or actually you mentioned you grew up in Hendersonville, so you're actually a native, been doing this. When you were a girl growing up in Hendersonville, did you always know you wanted to run your own business and be a physical therapist, have this kind of business?
Yeah, I had no idea. I had an inclination of being a physical therapist from probably the high school age and on, but as far as being a business owner, never wanted to, never thought that I wanted to. And so that's kind of the interesting part of my story. But I had a big background in sports and in softball. I ended up playing softball in college, and kind of have that typical story of having injuries and having things that brought me to have exposure to different types of physical therapy, and realized, wow, that was really cool. That looks like something that I would really enjoy doing. And so, in college, I had more injuries. I had more treatment, and was able to shadow and gain some hours, and realize that's what I wanted to do. But the business side of things is a total twist, and is not something that I finished my doctor of physical therapy program anticipating to do. But after some years of working, ended up kind of realizing that was going to be the best way to treat patients.
So when did you come to that realization? You were working for others, and then you decided you want to go on your own?
Yeah, so I got out of school and worked full time in an outpatient orthopedic setting for about 3 years. 2 years when I started my business part time, 3 years working at an various in-network clinics. And it was a great experience in that it gave me a lot of repetitions in working with people, and as far as developing kind of an eye for evaluating what's going on and how to best treat folks. So I got a lot of reps. But that was part of the problem too, is that each year and each month that went by, the demand was higher for how many units they wanted me to bill and how many patients I was seeing at once. I mean, as far as seeing 2 to 3 patients at one time. And I just realized that not only was I being burnt out and didn't feel like I could give the best care to those patients, I couldn't develop the relationships I wanted to, and just didn't feel like I could make the meaningful, long lasting results that I knew that I could, as I was continuing down that in-network road. And so that's when I opened my own practice, and transitioned to full time over about a year or so. And that the model that I practice in is quite different than the in-network model that I had originally started in, because now I'm allowed to be one-on-one for an hour. We're able to take a really comprehensive approach where we have the time to actually think about hydration and sleep and diet and all the factors outside of just physical therapy and moving your body that is going to help really make meaningful changes for folks.
I have to give you a compliment, and that's one of the things that I think is so cool about you, that, I've worked with other physical therapists and they've been fine, but nobody seems to have kind of the, I guess, comprehensive or overall viewpoint that you have. And that I know Cynthia is really appreciating that you're not only doing the physical therapy, but you're also working with her from a training standpoint. So I've never seen that quite with somebody before. But what was that? The idea being that, I guess, helping the person more than just the physical therapy.
Yeah, so I actually have not only a personal background in strength training and obviously performance, but I'm a certified strength and conditioning coach as well. So I really try to blend rehab and performance because I find that in the traditional physical therapy model, there's this hole where when insurance is involved, and we can talk more about that too, but when insurance is involved, they want that physical therapist to be treating one body part and one condition with one diagnosis, and they want you to focus on that and get that better, get you out of pain, and get you back to like basic activities of daily living. When I find that people like me and the active adults that I work with, 35 to 65, and I do see younger athletes and I do see folks over 65 too, but I would say the primary folks I see are 35 to 65 active adults. Those folks want to get back to more than just like rolling over in bed and like getting up off the chair, right? They want to be able to pick up their grandkids. They want to go to the gym, and they don't want to give up those active things they love to do. And so I really focus on blending the gap, because a lot of folks get discharged from traditional PT and they feel better, but they don't know how to get back to those higher level activities. It's just kind of a gap in our model that I find ends up catching a lot of people and kind of falling back into that path of dysfunction and pain when, you know, they were nearly there. They just needed that extra help and that guidance.
And what I so much like about what you do, and so does Cynthia, is that again, it's not necessarily focusing on just one thing. You know, like I'll be working with you, and then I'll say, well, what about this? You know, and you don't say you can't do it, but you just take it right then and there. And Cynthia is really appreciative of the fact that you're working with her on a bunch of different things, as opposed to the traditional model. You'd only be able to do one thing for 8 weeks or 10 weeks, and then you're done.
Exactly. And, you know, really, when it comes down to it, solving pain and solving a dysfunction in mobility or how you move needs to be taken through a comprehensive scope of view. Because if we just look at your hip and say, oh, I have hip pain, well, that may very well be coming from your low back or your mid back or your knee and ankle. And so if we don't take the time to really find the root source of what's happening and be able to change how you move, the tissue texture, all those things, at some point that's going to come back, right? And my goal is, let's make meaningful long-term changes, and let me educate you and give you the tools to make sure you manage and make sure that doesn't come back. Because I don't want you coming back. And much as I love it, my patients, I don't want them coming back to see me forever. Really, we want to make sure. We want to make sure that you've got the tools to take care of your own body, and that's the biggest thing.
And talk about the process. And again, it impressed me the very first time I met you, that even before I could work with you, you went through I guess it was a phone call or Zoom call where you found out, I guess, where I was and what I needed to be and where I wanted to go. What's that? How do you describe that?
Yeah, that's a part of my treatment model, where that's what I actually encourage folks to do if they're interested in learning more or working with me. We set up and schedule a phone call where we've got, you know, as I said, about 20 minutes. Usually we take most of that, where most places you're not going to speak directly to the doctor of physical therapy. They speak directly to me because I want to know what's going on, what treatment you've had, you know, what are your goals, what's the bigger picture. And then I want you to learn more about me too, and make sure we're a good fit. And so that's kind of an extra step before getting somebody in for an evaluation, where we can really make sure that we're a great fit, and I can really learn about what's happening with you.
By the way, you mentioned kind of a key thing there, finding the great fit. How does somebody, such as myself or anybody else, evaluate or find out if the person they're going to work with is the right fit? Like, what are the kinds of questions I should be asking you or seeking information about?
Yeah, that's a great question. You know, when you're seeking care, especially for physical therapy, one of the big things that I would recommend finding out is, after your evaluation, are you going to continue to be one-on-one, and are you going to continue to be with the same physical therapist? That's a problem as far as continuity of care. I'm sorry, I'm itchy nose over here. That's a problem in my former positions with continuity of care, is that I may evaluate you, but then you see 3, 4, 5 other therapists and techs and tech assistants throughout your process. And I think that you cannot be the type of relationship you build and type of progress you can make when you're having consistent care from the same provider. And so I think asking, you know, am I going to continue to be one-on-one, and will I be able to see this same provider throughout my plan of care is probably the most important question to ask. And then, as well as, do they have the tools to get you not only out of pain, but back to the things you love to do? because a lot of clinics might only have a 30-pound dumbbell at most. And for some of the folks I see, you know, I might have a 260-pound power lifter, and 30 pounds means nothing to him, right? So I need to make sure that that clinic has the tools to actually get me back to that high level performance, and not just have me roll around on the table for 30 minutes when that doesn't look like the things I want to get back to doing.
I'll give you again another compliment if I can, but it's kind of a funny story about after you saw my wife. She came home one day and said, "How was the session?" "Great." "And what do you do?" "You play pickleball." And I said, "Whoa, what do you mean playing pickleball?" But I'll mention it as an example because that's something Cynthia wanted to be able to do, and you wanted to see if she could do it. And it was just a great session for her. You know, she played pickleball for the first time, or so she could do it. And that was great because it ties into what you were saying earlier, that you want people to kind of know what they want to be able to do, and I guess help them to get there. You know, so
Yeah.
do you do that with a lot of folks?
I do. Yeah, it's really individualized, and I try to really just empower the person, because part of it is just safely and gradually returning somebody to the things they want to do. And if we've never tried that thing, and then I cut you loose and you're discharged, and then you go to try that thing, not only is the confidence not there, but physically you haven't done it since the injury. And so your body's not going to be in a great place to return confidently to that. So anytime I can get somebody out to play pickleball, out to swing a golf club, get under the barbell, and let's make sure that those back squats or whatever it might be looks good, that's my goal.
And same kind of thing. We had another fun experience with you that one time you actually came to our place and helped Cynthia run. We just got a tricycle for two, which is kind of cool. And you helped her ride it. And that, we appreciate the fact that you did that. But that's kind of cool because that's what she wanted to be able to do. And I wanted to be
Yeah.
able to do with her. The only thing you have to work with her and me on, we're still having trouble getting up the hill. You know, we have this
Yeah.
big hill. And it's so funny because other people, young kids or whatnot, they can get up the hill, no problem, you know, but we still have to, so that'll be a goal, Sarah, when you work with her, see if she can
Absolutely.
get up the hill. But again, ties into what you were saying. This is what you wanted to be able to do, and you wanted to be able to help to do it in a safety way. I guess, was that the first time you ever worked with somebody on a tricycle built for two?
That was my first tricycle built for two. I've never been on one. It was a cool experience to try. But that's the beauty of this model is I see less patients overall. I can really pour more into them. And when we need a house call, when we need whatever to be done, I'm able to go above and beyond and just give care that I was not able to give previously.
And again, that's the first time I think we ever had a physical therapist make a house call, so we appreciate you doing that.
Oh yeah, absolutely.
Talk about the kinds of folks you work with. So I told you a little bit, you work with me a little bit, with Cynthia. Who's your ideal kind of patient, or who are you looking to work with?
Yeah, I've found that the most specific, and I've worked with a lot of folks, but the most specific type of person that I'm working with right now is like a 35 to 50-year-old mom who may be a professional, maybe a stay-at-home mom, busy life, but they're a gym goer. And so they might be a part of a burn boot camp. Shout out to them because I've got a great relationship with them. And not only is it just a great environment, they have childcare on site for moms. And they have all kinds of folks working out there, but it's obviously a great spot for moms.
Let me just stop you because I'm not familiar with it and make a introduction. I might want to do a show on it. What kind of camp was that?
It's Burn Boot Camp.
Yeah.
And so it's a type of training gym. They call them camps. And so it's a group style fitness training where they have strength training. They have, more cardio hit based exercises. And it's a place that I go to work out personally a few days a week. And have been there now for over a year and a half, and just really enjoy that community and that group of folks there.
By the way, off the air, give me an introduction to that. That I'd like to do a show on them. That'd be kind of fun.
Yeah.
But even where you are is kind of a cool place because not only do they have your office and facility, but it's also part of what else is it?
It's called DBAT. It's a 16,000 square foot baseball and softball training facility. And so I've got a private space inside DBAT, but I also have shared access to all of their open turf. And so that's another place where if I need to take someone out to run or to try agility things or to go play pickleball, those types of things, we can go outside and use that space, which ties into what I was telling you about the questions to ask of, does the facility have what I need to return to the things I want to do?
Do you work with any athletes? Again, such a great facility for it, who are softball players or I don't know, do they do hardball there also as well?
Yep, there's baseball and softball primarily there, and there's even one-on-one lessons provided, or you can go rent a cage to go practice. But I see a percentage of athletes. They're not all baseball and softball players. I would say I specialize in rotational or overhead athletes because that's my background, and softball is a throwing sport. So I certainly see and problem solve with a lot of throwers, whether it's baseball, softball. I have some tennis and golf folks right now. I have some soccer players. So not exclusively just baseball and softball, but that's definitely my background.
Okay. And the cool thing, us being a good example of it, Cynthia and myself, that so the age range you work with, I guess, what's the youngest you work with?
Well, the youngest I've had recently is 9 years old, baseball, softball player. I usually I'd say about high school. A motivated middle school to high school athlete is about as young as I typically see. But if they're a great fit and they're a motivated athlete, they're bought in, I've seen as young as 8 or 9.
And oldest?
The oldest, probably 70, late 70s.
Okay, I qualify. But talk about the fact then, you said a motivated kid. So a 9-year-old or anybody in junior high school, whatever, what are they coming to you for?
So for one example, somebody I worked with today, a 9-year-old baseball player with elbow pain. So a lot of throwers, especially boys, as they get into playing and playing a lot, they have a lot of throwing injuries. And so he had a throwing injury that kept him from throwing for about 6 weeks. And so his parents got him in. So we worked on a lot of strength training and stability work and making sure his mobility is good. And then when it was ready to return to throwing, I'm a great person for that because I used to do some one-on-one lessons with softball and baseball. So we're able to get him back right into the throwing process and make sure that the form looks good, the mechanics are great. And now he's working more on long-term strength and making sure that he's really solid for the fall season.
So somebody not only 9 years old, but could be any age. So if they've hurt their elbow or hurt their arm throwing, like especially pitchers, can that be rehabbed? Can that get better at some point in time?
Absolutely. And my big thing is that I try not to take folks out of the activities they love to do.
Right.
I think there in 9 out of 10 times, there's a way to keep folks moving and just modify around the things that are a problem. Because I don't want someone to stop going to the gym or to stop playing baseball just because they have some pain. There are times, of course, when we have a physician involved where they might need to stop throwing for 6 weeks, say, for healing's sake. But absolutely, we can implement the right manual techniques, and then the right strength training and stabilization training to get somebody back to something like throwing without pain.
How about pitchers? Have you worked with pitchers who have had, Tommy John? Have you worked with anybody who ever had Tommy John surgery?
I've worked with some Tommy John and some labral repair surgeries for the shoulder. Those are really common ones in the throwing athletes. And as well as some ACL reconstructions in general athletes. Those are long-term rehab processes that typically in network clinics are not set up to really get them all the way return to sport. They're great early on, but they may not have the tools to get you like at the return to sport stage. So that's really where I step in a post surgery situation.
It's an incredible thing about the Tommy John surgery. Some of them come back even better than they were before, which is kind of amazing. The other thing I wonder, I'll ask you, have you had folks with hamstring problems?
Lots recently. It seems to come in a wave.
Well, let me ask you this. I don't understand that, professional athletes, is there anything, professional athletes, college athletes should be doing differently to prevent hamstring injuries? They seem to, like you said, come in waves and makes professional athletes, and then they're out for long periods of time. What should people do to be doing to get away from having hamstring problems?
Yeah, I think one of the first things that comes to mind is we're naturally built with a little bit more quadriceps or front of the thigh strength and a little less in the hamstrings on the back of the thigh. So we really want to make sure that we build a really strong hamstring that's really durable. And that can come from hamstring specific exercises like a RDL or a deadlift movement where we hinge at the hips and bend forward, as well as hamstring curling exercises where we bend the knee to contract that muscle. A favorite one, which some of your listeners may or may not have heard of, is called a Nordic hamstring curl. And you are in a tall kneeling position and somebody's holding down your ankles and you have to lower yourself down really slowly to the ground. Exercises like that really build the tolerance and the strength of those hamstrings and can prevent injuries when a long season's coming. As well as I would say making sure you're really warmed up before you do powerful explosive movements. And those two factors are huge.
But you would think that professional athletes, especially getting big bucks, would know this, or I guess they've never been trained, or they don't have trainers who train them. In other words, if an athlete's had a hamstring problem, can they get to the point where they won't have hamstring problems in the future?
They can. They're stubborn, and if you push it too quickly, there's that instance of recurring problems every few weeks. Oh, I tweaked my hamstring again. And so that's an instance where sometimes it takes some really careful progression to return to running, especially the sprinting and the holding of a sprint for more than 20 yards or so is an instance where most folks see a hamstring injury happen. It's not short duration sprints and takeoffs. It's like long held sprints at full capacity. And so a lot of times, yeah, they need to be working specifically with not only a strength coach, but a physical therapist to ensure that they're checking all the boxes to make sure it doesn't come back. But you absolutely can get to a point where that does not occur anymore.
Do folks come to you with back problems?
Oh yeah, lots of back problems.
And same kind of question, can somebody get to a point where they work with you or get appropriate exercise and they'll be cured of their back problems?
Mm-hmm.
Is that
I
what
would say
happens?
a big part of what I do is just encouraging folks that what they have going on will in fact go away, and giving them some light at the end of the tunnel. Obviously, I can't promise anyone that we're going to 100% get rid of anything, but the success rate is really high when somebody buys into a plan of care and what I'm preaching, and puts in the work themselves as well. I think there's a lot of factors that go into back pain, especially low back pain, and a lot of times it's chronic. And so I tell people the longer something's been going on, you can anticipate that the longer it takes to resolve. But that doesn't mean it's not going to get better and eventually go away. It will and it can. And I have lots of folks where that's the exact story.
Well, you said something scary a little bit, that they have to put in the work. I mean, I thought I would just come to you, one time and I'd be cured the rest of my life. But sometimes it
Yeah.
takes more than one visit.
Oftentimes for long-term results, it's going to take a plan of care. It could take 6 visits, it could take 12, and some folks longer than that, depending on what's happening. I would say I usually have folks out of pain within 2 to 4 visits, and I do a once a week visit. Typically, I don't see folks more often than that. So we can have pain managed quite quickly, usually, like I said, within 2 to 4 visits, especially if it's something a little bit more acute or subacute. But it's the making sure it doesn't come back, and it's those extra visits that's really where the magic happens.
And one of the things I like about you and talk about the magic happening
Mhm.
is you're not necessarily a big advocate of sending somebody to a surgeon, that they have a pain in the knee or a pain in the back or something. I guess you always have an option to go see a surgeon, but that's not typically, which is cool. That's not the first recommendation you make usually.
Yeah, there's a time and a place for medications and injections and surgeries and imaging. But I definitely don't encourage that right away because there are there's a lot of things to overcome when someone goes and even gets, say, an MRI and they get back all this bad news. And it's really harmful for, the wording we put around how we describe an imaging result, say, like you've got a disc herniation and it's severe and you may never walk again. It's like it doesn't need to be that because our bodies heal, and conservative treatment works. And so anytime I can save someone not only the time and the hassle and the pain and the finances from going to spend money on injections and surgeries and medications, I can, because that's most folks come to me and saying, I don't want surgery. I don't want to do it.
Yeah, I guess too many people don't come to you and say they want surgery, and whatnot. But tell the story, and I'd like to get your reaction to it. But about back pain, years ago, I only had back pain once in my life, and I was told I had a herniated disc, and that was terrible. It's the worst thing you can possibly have, and all sorts of treatments and different things, and needing surgery, whatnot. And I read a book, by John Sarno. Do you know who John Sarno is? Someday
I
I'll
don't
tell you
think I
about him.
do.
Healing back pain. Anyway, the point to the story was I read the book, I was better the next day. It's just incredible. And I'll owe you that. I'll send you information on him. But it was good
Yeah.
that I worked with a lot of doctors, and they were all different people, wanted different approaches, And that was I'll have you talk about this as well. The idea of going to too many specialists, So at the time, I was seeing a massage therapist, a physical therapist, a neurologist, 3 or 4 different people. They're all telling you different things. Do you have that happen? People come in and tell you that?
I have had that experience for
Yeah.
for sure. And folks who have just tried a lot of things and just think that nothing's going to work, right? I have a lot of people who've had a lot of physical therapies even and come to me really hesitant, thinking it's just not worked in the past. But I've heard it described as this, like, is the first person, and some people will say yes to this, but is the first person you dated who you married? Not often, right?
Right.
Sometimes you have to date a few people to find the person you want to marry. And it's kind of the same thing with a provider, whether it's a physical therapist or someone else. The first person you see might not be the best fit for you. Their skills and their expertise might not be able to solve your problem, or at least long term. And maybe it's just not a great fit for a variety of reasons. And I try to encourage people not to give up on a particular uh, type of therapy or type of medicine just because they've tried something that hasn't worked, because everybody's different.
And I sort of like your approach with the idea of, even in terms of x-rays, that you don't necessarily need to get 27 more x-rays to find out what's wrong with you. The issue is to get better. And what's your goal?
Mhm.
To find out? I guess that's an interesting thought, to find out what's wrong with you, or to get better. I guess the better approach would be to get better as opposed to find something else, because I guess anybody could look at an x-ray and find something wrong with it. A lot of people can find something wrong. And I loved your
Right.
attitude. You said, hey, stop with the x-rays. You don't need more x-rays. But a lot of people
Mhm.
do think that's the solution to everything, just get more x-rays.
Yeah, and I think they think it's also going to help their care after, but if we don't make a change in your symptoms or your issue within a few visits, I'll be figuring out why, because that's unusual. We're going to get positive results. And if we're not, you'll be referred to the correct person to start figuring out what's happening. But that's unusual, as I said. And I find folks don't need more imaging. What I do in my evaluation is based off of the deficits I see and how you move, the quality of your movement, your pain, your symptoms, all those reps I mentioned I got early in my career help lead me and guide me down, telling me what's the best way to treat you, as well as really just listening to the patient. Because the longer I practice, the more I realize if I'll just shut up and listen to what they're saying, you're going to give me the answer and more clarity on what the root cause is. I just have to listen.
If somebody hurts himself playing, even in the sport, football especially, or just hurts himself in general, what's the first thing they should do? In other words, they're hobbling around or whatever. What's the first thing they should do?
I'll give you an example of somebody rolls an ankle, let's say,
Right.
and it's acute and it's swollen and it's, they've blown up their ankle. The previous protocol was called RICE, rest, ice, compression, elevation, and almost everyone's heard of that, right? They'll like, I'll just ice it and elevate it and all those things. Well, the interesting finding about that recently is that ice is no longer recommended.
Really?
And so there's a protocol in place for what we need to do immediately after, but the basics are you don't want to totally rest and stop everything either. You want to move with intolerance, respect the injury, but stay moving. Compression is fantastic. So, compression sleeve, let's say, or a compression sock over that swollen area, perfect. Elevation is great as well to help with manage the swelling. But we don't want ice, and we really don't want anti-inflammatories like an ibuprofen if we can help it, because what those do are they actually diminish our body's natural healing response. Our body swells to help with an injury intentionally. It's the inflammatory phase of our healing process, and we don't want to stop that. We just want to manage that swelling and stay moving. And so when we stick that ankle in a bucket of ice water, it's really stopping the blood flow to the area and slowing down your healing. And we want blood flow in the area. Blood flow is healing. And so that's one of the big things that I preach and help folks with after an acute injury, that I find is still being, a lot of people are still saying, oh, just rice, just use rice, when that's actually not recommended anymore.
Have you worked with football players?
Mm-hmm.
What about, they get hit in the head or see stars? What should you do when that happens?
Yeah, if those symptoms persist more than a day or two, there's reason to consider there could be some concussion-based injuries happening there. And those are pretty serious. Obviously, our brain is precious, and we want to take that seriously. A lot of high school and collegiate sports leagues now have testing for that, so the athletic trainer needs to be involved pretty quickly to make sure that they can do a test after the injury and make sure you're safe to return to sport. And sometimes in larger scenarios, neurologists and other folks need to be involved. But really it depends on severity of symptoms. If they persist more than a day or two, if you're continuing to feel, nauseous and dizzy and those sorts of symptoms, that's unusual. Your body should be healing quicker than that. And you would need to see a physical therapist that can specialize in those types of things, and or your team's athletic trainer and
I think we've lost Dr. Sieara Hinshaw. Can you hear me at all? If not, we're just going to pause this for a second and hope she comes back. So give me 1 second, folks. Welcome back to the Blaine's World webcast. We were having a little technical difficulty, but I think we're all set. And we're with Dr. Sieara Hinshaw, who's Director of Physical Therapy and owner of Outshine Physical Therapy and Fitness. Dr. Hinshaw, we were talking a little bit about the idea that about whole concussions. And I was starting to ask you the question, I believe, is that if somebody gets hit in the head or sees stars or whatever, what should be the next thing they do?
Yeah, it's in most of our organized sports leagues now, especially at a more competitive level, like high school or collegiate or professional, certainly. There's some pre-testing that's typically done pre-concussion, so we know what a baseline looks like. So that way, if something happens, we have an idea of how to test you after to make sure that you're safe to return to sport. And there's a protocol to return to sports safely after that. A lot of times the first person to be in touch with is your athletic trainer, because they're going to be a big role in communicating to your team's physicians and your team's physical therapist or a physical therapist that specializes in this issue. But certainly within the day or two of having impact, you may have some symptoms like nausea and dizziness and, some of those things that stand out after a head injury. But if that's not improving rather quickly, then you want to make sure you're getting into care with a physical therapist and potentially even a neurologist, depending on the severity.
And I set you up for the answer because I think I know what you're going to say on this. But one thing, if you get hit in the head or you're hurting or whatever, you shouldn't hide it at that point in time. In terms of getting back in the game or on the field, not a good idea to not share the information that you're hurting.
Absolutely. That's something I've worked with a lot of competitive high school athletes and male soccer players on, although it happens in all sports and all genders, because I've been there. The competition is real. You want to get back in the game. You don't want to let your team down. But your brain is obviously not something to take lightly. And if you continue to have repetitive concussions, then we can have long-term problems from that. And so we really want to make sure that you're super clear with the folks that you're working with and transparent so they can give you the best care possible.
And Dr. Sieara, 2 last questions, if I can. One having to do with the fact that aside from working with people on a one-to-one basis, I know you do some small group work. What's that all about?
Yeah. So when I actually started my practice, I inherited a small group training company, essentially, where I had 15 or 20 women who came in for small group strength training. And it's evolved into what it is today. Right now, it's small. It's groups of 3 to 4. It is women only. I have women anywhere from 31 to 74 right now in those small groups. And a lot of them are folks that I have seen in a one-on-one plan of care, rehab specific capacity, and they've moved into small group training if they didn't formerly have a home gym or somewhere to return to activity with. And so it's a really great option for some of the folks that I work with who just need that extra step and that accountability and my eyes on them. I would almost call it a clinical strength training, but at its roots, it's functional strength training that's really modifiable to any age level.
And also, I'd like you to talk about one other thing you do when you work with a friend of ours, mutual friend, Michelle Riley. And what's that work entail?
Yeah, we've partnered up with Asheville Personal Training and Michelle over there to do a stretch and mobility class. And right now we're doing it every other Saturday at 9:30 a.m. and she's hosting it at APT in Arden. And so typically we're kind of trading off. I may lead a class, and then in 2 weeks she may lead a class. And it's a low impact class that's based on improving your mobility, making you feel really good. And I always say I hope folks can leave with 1 or 2 things that felt really good for them today that they felt like their body needed.
And Dr. Sieara, if somebody wants to get in touch with you or find out more information, what's the best bet?
Absolutely. Yeah. So I'm pretty active on Instagram if you're a social media person at Outshine PT and Fitness. And I've also got a website, same thing, www.outshineptandfitness.com. You can directly book a call with me there. You can message me to inquire for more information. And you can read a little bit more about what I do and what I offer and who I am.
I'd like to thank you for being my guest, Dr. Sieara, on this edition of Blaine's World webcast. I'd also like to thank my producer, Cappy Cassetti, for helping set this up. And I'd say I hope to see you soon, but knowing us, I'm sure we will. So anyway, thanks for being my guest, and you were great as always. Be well.
We will. Thanks, Blaine. Appreciate you having me on.